The Department of Health in Gauteng says there's been an increase in the number of children who are abandoned in hospitals. In 2021, there were 119 babies left at these hospitals. This year alone, 56 have been abandoned at Gauteng hospitals between January and August. Let's talk about this with Dr. Shaheda Omar from the Teddy Bear Clinic. Doctor, a very good afternoon to you. Grateful for your time. So, at the heart of most of these cases are women who, as is sadly a common occurrence in South Africa, are poor and unable to fend for themselves and their children.
Indeed, I think this is a reflection of the crisis that we are facing in this country. We're looking at the socioeconomic status, but we are also looking at the desperation, because what drives a female to abandon her baby, something that's come out of her that she's actually carried for 9 months. One needs to appreciate and recognize that it's probably a lot of factors that have contributed to this kind of response. And the statistics that you have outlined or identified, I think it's just scratching the periphery, because there are many babies that are born and are born dead, or are abandoned in dustbins, or abandoned in derelict places where they are not even discovered, or maybe discovered later on. So I think the harsh reality is that there are many risk factors that contribute to this kind of conduct, and we have to unpack that. This is a systemic issue, that we are also looking at a lot of violence, we are also looking at poverty, we are looking at the ages, the high-risk age cohort of these mothers as well, where out of fear, out of desperation, we find that because fear of reprisal and the stigma and the humiliation if they are younger, much younger, and lack of access to resources or support from families would drive these people or these females into acts that we consider unacceptable.
Right. And just on that point that you were just making, when a woman has decided that she no longer wants a child after giving birth, or realizes that in fact, looking at her economic situation, she would not be able to give the child the best quality of life, how is that decision then treated at hospital level? Would these be women who, for instance, give birth, then leave the child there, or is there a process formally to leave the child at hospital?
Well, I think if we just look at supportive processes, interventions, because these females are giving birth, but there's no support. If we look at the hospital facilities, yes, social development is present in some of these hospitals, and I can speak specifically to Charlotte Matseke, where we know there's a social workers present within the social work department. But in terms of support, in terms of actually providing any kind of response to these young women that are coming in, these females, what are the intentions? Are they okay? Are they comfortable? Are they contained? Do they need any debriefing? Do they need any counseling? Do they need information on resources that are available out there in terms of adoption or placement of these babies? I think there is a lack of that kind of support. So they go in, and of course, they don't see a way out. This is their only way. Their intentions are probably noble, to leave their baby so that the baby can get some kind of support and long-term care. They hope for the best, and out of desperation, disappear.
And where do these children then go in these situations? Is it an automatic decision from the hospital managers to then transfer them to the care, for instance, of social services?
Well, social services have to be brought in. I think there is a protocol around the, placement of these babies, and then if they become the custodians of the Department of Social Development, and of course processes follow through, where they would have to wait a waiting period and put adverts out there for these babies to be claimed by their biological mothers. If that does not follow through, then of course they would have to look at long-term placement.
And what about the father, Dr. Omar? Where are they, the fathers, in this sort of scenario?
And I'm so glad you raised that, because that was something I was going to also flag, that often because of the lack of paternal presence, the lack of paternal responsibility, the rejection, the abandonment by their partners, and if they are both teens, it becomes a greater challenge and more difficult to expect any kind of not only emotional and physical support, but even in terms of economic support. And this could be one of the reasons that motivates and drives mothers to actually abandon their babies, because they feel there is no support even from the paternal figure.
And women face enough judgment, right, when they say they want to terminate their pregnancy, get an abortion. What more when you've actually been pregnant for 9 months and realize at the end of the process that actually this is not what I want, or this is not what's best for myself and my child?
Indeed, and I think that's often the case, and that's why when I speak about counseling and support, enabling people to make informed decisions and providing them with options, that's not easily available. And even if what is available out there, I don't think people are aware of the kind of resources they can access. So there's a lack of awareness. A lot of psychoeducational awareness needs to be done, because, the expectation is that once you're pregnant, you need to go through that pregnancy. But even the response of actually requesting a termination of pregnancy is viewed with such criticism and negativity. So sometimes females just go through the process knowing fully well they actually cannot cope with having a baby. They themselves are so challenged, and this would not be a process or a journey that they could continue with.
And Dr. Omar, while we have you, I don't know if you've seen the story we've been reporting in the last 2 hours about a dreadful situation in the Eastern Cape where a mother has now been arrested. She's accused of killing her 4 children in the Eastern Cape using a hammer. Just your reaction to that news today.
Well, it's horrific, but the maternal filicide that we've seen over the years, the hate crimes and the desperation, and of course the mother's probably emotionally, totally in an unstable state to have committed such a heinous crime, and the fact that her 4 children have now succumbed to death under her own hands is the guilt, the survivor guilt, and things she would have to live with. One cannot even begin to speculate what drove her to commit such a horrific and brutal crime against her own flesh and blood. What
then would you say, Dr. Omar, to the retort that in such cases, yes, we don't know the full set of facts. Police have said they're being very careful. She's been arrested because she was found at the scene with the lifeless bodies of her 4 children and this hammer that's believed to have been used in the attack itself. But listening to this, often when we report on women who are accused of killing children, killing romantic partners, people say we absolve them of just having had malicious intent.
Well, again, I think if we look at this current situation, she's going to have to undergo psychiatric observation and of course, she'll have to be observed, and one would have to look at the context. Of course, we have to separate the person from the action, and what she has committed is unacceptable, it's unlawful, it's just horrific, horrible, and of course, actions have consequences. The law will have to follow its process, but at the same time, one cannot discount or dismiss where she has come from and the support in terms of intervention, therapy, and psychiatric administration that she may need.
Right. Dr. Shaheda Omar from the Teddy Bear Clinic. Good to have your time. Thank you.